So in this video, we are going to see about anatomy of tongue and how to do a quick reading of this topic so that you can prepare for your PG entrance examination. So regarding the tongue, what are the things that we already know about? It is a mobile muscular organ. What type of muscle is present here? The skeletal muscle. What is unique about the skeletal muscle? In this, it is present as a continuous cell. Okay, and it is situated in the oral cavity, but the posterior most part of it is situated in the oropharynx. Okay, so what is about the skeletal muscle? They are branched structures and they will be striated. Okay, skeletal muscle are striated, and you can see that these skeletal muscles are voluntary in nature. So the tongue is made up of skeletal muscle. That is important. And it is present in the oral cavity extending up to the oropharynx. What are all the muscles related to tongue? There are intrinsic and extrinsic group of muscles. What do you mean by these two terms? Intrinsic muscle means it originates and inserts into the tongue only, within the organ. Extrinsic muscle means one end of the muscle will be attached to this organ and the other end will be attached to the adjacent structures. What are all the functions? It helps in perceiving the taste. It also helps in speech, chewing and swallowing. These are all the functions of tongue. Regarding the external features, okay, so we will be dividing the tongue into three parts: the tip of the tongue, body of tongue and root of the tongue. Tip is the anterior-most part, free part of the tongue, that is against the central incisors in the front. The body of the tongue is divided into posterior 1/3 and anterior 2/3. The root of the tongue is situated beyond the posterior 1/3 of the body. Okay, that is the posterior most attached part. Okay, root is attached. It is attached to what all bony structures? To mandible as well as the hyoid bone through some muscles. We will see what those muscles are. What are all the features that you have to know on the dorsal surface of tongue? So this is the dorsal surface. What you're seeing above is the dorsal surface of the tongue in the anterior 2/3. Okay. In the anterior 2/3, it is also called as the oral part of the tongue. It is supplied by first and second. It is developed from first and second arch. Okay, which means that it has supply from trigeminal nerve as well as the facial nerve. The posterior 1/3 is supplied by the third pharyngeal arch. Okay, remember the posterior 1/3 is by the third pharyngeal arch, which means that it is supplied by the glossopharyngeal nerve. These are all very important for your MCQs. Anterior 2/3 is by the first and second arch. That's why the sensory supply is by the lingual nerve, general sensation, and the taste sensation is by the chorda tympani nerve. Posterior 1/3, both the sensations are by the glossopharyngeal nerve because it develops from the third arch. In addition to that, you have to know that there is a sulcus that separates the anterior 2/3 from the posterior 1/3. The sulcus is called as sulcus terminalis. At the center of the sulcus in the midline, you have a foramen called as foramen cecum. Okay, so that is called as foramen cecum. In front of the sulcus, you have some papilla. Now, for that, you should know what a papilla is. You can see that the dorsal surface, the upper surface of the tongue is not smooth. It is rough. You can see minute epithelial projection. They are the papillas. Okay, so in front of the sulcus terminalis, you have a specific type of papilla called as circumvallate papilla. What do you understand from that is circum means all around, vallate means valley. There is a valley all around the papilla. Okay, so that is circumvallate papilla. They are situated 8 to 10 in number and situated just in front of the sulcus terminalis. The important MCQ here is the posterior 1/3 of the tongue as well as the circumvallate papilla are supplied by the glossopharyngeal nerve. These circumvallate papilla will have taste buds in them that helps in perceiving the taste. And then we have on the posterior 1/3, you can see irregularities, roughenings, that is because of the lingual tonsil as well as glands. Okay, serous and mucous glands in the posterior 1/3. Now, this lingual tonsil is a component of a mucosal ring called as Waldeyer's ring. Okay, that is important for your MCQ. Waldeyer's ring is formed by which all structures? We have the lingual tonsil, we have palatine tonsil, tubal tonsil and pharyngeal tonsil. This forms the Waldeyer's ring. This lingual tonsil is situated in which part of the tongue? The posterior 1/3 of the tongue. Next, we will see about the features in the anterior 2/3 of the tongue. In the midline, we have a median sulcus. Okay, we have a median sulcus, and on the either side, we have the median sulcus is also called as the median furrow. And on the either side, we have lot of other papilla called as foliate, filiform and fungiform papilla. So for every papilla, you have to know if whether taste buds are present in them or not. And in addition to that, you should also know the location of each papilla. Circumvallate papilla is situated just anterior to the sulcus terminalis. The foliate papilla is situated on the lateral aspect close to the sulcus terminalis. Okay, on the lateral border close to the sulcus terminalis. The rest of the part of lateral aspect is filled with fungiform papilla. Okay, so all these are fungiform papilla in the margins. The entire rest part of the tongue consists of filiforms. This is the covering the majority of the surface, the filiform papilla. Out of this, only 2 papilla consists of taste buds, that is circumvallate and fungiform papilla consists of taste buds in them. So this is about the dorsal surface of the tongue. All the features that we saw were lingual tonsil. Okay, in the posterior 1/3 we saw lingual tonsil as well as we saw the serous and mucous glands. Okay, serous and mucous glands. And in the anterior 2/3 we saw a median furrow and we saw the division between the two anterior 2/3 and posterior 1/3 is by the sulcus terminalis. At the center of it we saw the foramen cecum. Now this foramen cecum is important because that is where the thyroglossal duct will originate, from which the entire thyroid gland will develop. Okay, thyroglossal duct originates from this foramen cecum. And we also saw about the different types of papilla: vallate, foliate, filiform and fungiform papilla. And this is the tip of the tongue. What are all the presenting parts of the tongue? Body, tip and root. Root is the attached part. And the body consists of anterior 2/3 and posterior 1/3, and it is separated by sulcus terminalis. Regarding the posterior most part of the tongue or the root of the tongue, you should know the following things. All of these are important for your MCQs, these terminologies. So what are all the things that you should know regarding the root? In the midline, okay, the posterior most part of the tongue, in the midline, the tongue is connected to the epiglottis. So this structure you're seeing here is the epiglottis. The tongue is connected to the epiglottis by a fold called as median glossoepiglottic fold. It's median with the N because it is present in the midline. Median glossoepiglottic fold. Similarly, on the lateral aspect, you can see 2 more folds called as the lateral glossoepiglottic fold. So there is elevation in the midline and on the either aspect. So there will be depression between the median and lateral glossoepiglottic fold. On either side, there is a depression and this is called as vallicula. This is important. What is the depression on either side of median glossoepiglottic fold. And then we have to know about the ventral surface or the under surface of the tongue. When you lift the tongue up, what are all the features do we see there? We have in the midline a mucosal fold. Okay, that fold is called as frenulum linguae. In some people, they cannot pronounce the S properly. They can't lift up the tongue up properly. That is because the frenulum linguae is attaching the tongue too much to the floor of the oral cavity, which is called as tongue tie or ankyloglossia. Okay, this is also an MCQ. And the frenulum linguae is attaching the tongue too much to the floor of the oral cavity. It is called as ankyloglossia or tongue tie. So this is the midline feature in the undersurface or ventral surface of the tongue. Immediately lateral to that, you have a vein called as deep lingual vein. Now, why is this important? Because some drugs such as nitroglycerin that has been given for heart attacks, it can act faster when it is kept placed under the tongue. Through this deep lingual vein, the nitroglycerin is absorbed into the body, by which there is faster action. It directly enters the bloodstream and gives faster action. So, nitroglycerin given in case of myocardial infarction or heart attack is placed or given in sublingual route. And the vein responsible for the absorption is deep lingual vein. On either side of the deep lingual vein, we have another pair of mucosal fold, okay, fimbriated folds on either side, that is called as plica fimbriata. So in the midline we have frenulum linguae, on either side we have deep lingual vein, and further lateral to the deep lingual vein we have the plica fimbriata. So we've covered about the external features of tongue, root, body and tip. And in the body, we've seen about the two surfaces, the anterior, the dorsal surface and the ventral surface. Let's see what are all the list of muscles that are present in the tongue. The intrinsic muscles are called as superior longitudinal muscle, inferior longitudinal muscle, and then we have the transverse and vertical muscle. Superior longitudinal, inferior longitudinal, transverse and vertical. The extrinsic muscles are genioglossus, hyoglossus, styloglossus and palatoglossus. We will see about the origin, insertion, nerve supply and action of these muscles. First about the intrinsic muscle. In the intrinsic muscles, I told you there are four groups: the superior longitudinal, inferior longitudinal, vertical and transverse. Let's see the attachment of the superior longitudinal muscle. It is situated on either side of the median raphe. The superior longitudinal muscle is situated on the either side of the median raphe, and it traverses the entire length from the apex till the root. And the inferior longitudinal is on a deeper plane. Okay, corresponding to this on a deeper plane. The transverse muscle attaches from the lateral border of one side of the tongue to the lateral border of the other side of the tongue. So that is the transverse intrinsic muscle. And then we have the vertical muscle. The vertical muscle attaches from the transverse muscle to the dorsal surface. So that is the vertical muscle. Okay, so superior longitudinal, inferior longitudinal, transverse and vertical. What are the functions of these muscles? The superior longitudinal muscle, when it contracts, it will make the tongue shorter and concave. Okay, it will make the tongue shorter and concave. And the inferior longitudinal, it will also make the tongue shorter, but it makes it convex. Okay, so that's the difference between the two longitudinal muscle. The one on the above makes it concave, the one on the below makes it convex. And then we have the vertical muscle that helps in making the tongue broad and flat. It makes the tongue broad and flat. The opposite action, that is narrow and elongated, is by the transverse muscle. So When the transverse muscle contracts, the tongue will become narrow and elongated. Whereas when the vertical muscle contracts, it becomes flat and broad. So these are all the attachments and functions of the intrinsic muscles of the tongue. Next, we will move on to the extrinsic muscles. The first muscle is genioglossus. Okay, and it is very important because this muscle helps in protrusion of the tongue or brings the tongue outside the oral cavity. Hence, it is called as the safety muscle. Okay, the tongue is not being swallowed inside. So, it is called as the safety muscle of the tongue, which is a genioglossus. It has attachment to the entire part of the tongue as well as to the hyoid bone. Okay, so that is the fan-shaped muscle called as genioglossus. It's originating from the genioid tubercle, the superior genioid tubercle on the inner aspect of the body of mandible. Okay, it is originating from the superior pair of genioid tubercles on the inner aspect of the body of mandible. And regarding the action, I already told you it helps in protrusion. Only muscle that helps in protrusion of the tongue, hence called as the safety muscle. This muscle is supplied by the 12th cranial nerve. Okay, it is supplied by the 12th cranial nerve, that is hypoglossal nerve. And then we have this muscle here called as the palatoglossal muscle. Okay, this muscle is unique because all the muscles of the tongue, be it intrinsic or extrinsic, is supplied by the 12th cranial nerve except the palatoglossal muscle, which is supplied through the pharyngeal plexus from the vagus and accessory nerve. So that is about the palatoglossus. It attaches from the soft palate. Okay, it attaches from the soft palate to the part of tongue on the side where the anterior 2/3 and the posterior 1/3 meets. It attaches from the soft palate to that junction. Okay, and it pulls the root as well as it approximates the palatoglossal arch on either side of the oral cavity. There is palatoglossal arch. It helps in approximation of the palatoglossal arch. So we've seen the origin, insertion, nerve supply, action of genioglossus and palatoglossus. The next muscle that we will be seeing is the hyoglossus, which means it is attaching from the hyoid bone to the sides of the tongue. Okay, hyoglossus. These are all parts of the hyoglossus muscle, and it helps in depressing the side of the tongue and making the tongue convex. Okay, the surface, upper dorsum of the tongue will be convex. Okay, and the next muscle that we are seeing is the styloglossus that attaches from the styloid process to the side of the tongue. Now, one key thing you have to remember is the this muscle here is the inferior longitudinal muscle, right? And this muscle here is the hyoglossus, and here we have the styloglossus. So the hyoglossus muscle inserts into the side of the tongue between two muscles. What are the two muscles? The inferior longitudinal muscle and the styloglossus. So that is important. Okay, and it helps in bringing the tongue upwards and back. Okay, the sides of the tongue is brought upward and back. That is the function of the styloglossus muscle. So what are the four extrinsic muscles? Palatoglossus, genioglossus, styloglossus, this one, and hyoglossus. These are all the four extrinsic muscles of the tongue. Regarding the nerve supply, all the muscles, intrinsic and extrinsic muscles of the tongue, are supplied by 12th cranial nerve except the palatoglosssus, which is supplied through the pharyngeal plexus by vagus and the 11th cranial nerve. This is the motor supply. What about the sensory supply? Anterior 2/3 of the tongue, the general sensation is by the lingual nerve because it is from first arch, and the taste sensation is by the chorda tympani branch of the facial nerve, because that is from the second arch. Okay, and the posterior one third is supplied, both the sensation, general as well as the taste sensation, is supplied by the glossopharyngeal nerve. In addition to the posterior one third, the circumvallate papillae is also supplied by the glossopharyngeal nerve. The posterior most part of the tongue, okay, is derived from the fourth pharyngeal arch, hence fourth and sixth arches. Hence it is supplied by superior laryngeal part, branch of the vagus. Okay, which branch of superior laryngeal? The internal laryngeal branch of superior laryngeal branch of vagus nerve supplies the posterior most part of the tongue as well as the epiglottis. So this is about the nerve supply of the tongue in terms of motor, sensory as well as general sensation and taste sensation. Artery is by lingual artery, tonsillar artery, ascending pharyngeal artery. Venous drainage is by deep lingual vein, dorsal lingual vein, and the venae comitans. Okay, the veins accompanying the 12th cranial nerve, the hypoglossal nerve. The lymphatic supply, the apex of the tongue alone is lymphatic drainage into the submental group of lymph nodes. The margins is into the submandibular group. The rest of the parts is directly into the deep cervical group of lymph nodes. Development of the tongue, I already told you, develops from 4 pharyngeal arches. First, second for the anterior 2/3, third for the posterior 1/3, and the posterior most is from the 4th and 6th. The components that helps in the tongue development is a pair of lingual swelling, tuberculum impar, and hypobranchial eminence or cupola of His. Okay, these are the components from which the tongue develops. Lingual swelling, this is a pair, and in the midline we have tuberculum impar. All these, lingual swelling and tuberculum impar, will help in development of anterior 2/3 of the tongue. Okay, the hypobranchial eminence or the cupola of His will help in development of posterior 1/3 as well as the posterior most part of the tongue. Thank you.